Hello, this is Josh Welch. We hear about coronavirus 24/7, usually a specific story on a single aspect. My talk today is an attempt to summarize the situation as time goes by. I'll share some numbers and my observations. Occasionally, I'll even share my opinion. This is actually a third in a series of coronavirus presentations, and I expect them to continue into the future. In terms of what I'm speaking out today, I'll start at the beginning, where we've been, put some pieces together, and work towards a conclusion. For most Americans, this chart made coronavirus personal. Delay the peak and reduce the height of the peak and spread the cases over time. We did a great job. When we learned about this situation, it was easy to overlook a detail on how we would conclude coronavirus. It's over when everyone has had it, or had the vaccination, or we've had a lot of luck. I haven't seen much luck yet. Johns Hopkins Hospital data is doing a tremendous job of gathering up the worldwide data. Everyone around the globe is using it. I'll be showing several charts from their information. The data will be normalized in daily cases per million citizens and the cases as a percent of population. Let's start with Italy. Since they're one of the worst hit countries, you can see they have ramped up and they brought the virus cases down dramatically. The chart is number of days since cases of a million citizens and daily number of new cases. Let's see how the US compares. The US is the blue line. We peaked at about the same level as Italy, time-wise just a few weeks later, and we've reduced the caseload somewhat, not as much as Italy. How about New York, since New York State has caught a lot of attention? It's the red line, and it's literally off the charts. The situation there has been horrible. Let's change the scale so we can see all the New York data. There it is. They have come down, but are still much higher than the US average. Since we live in Oregon, how's Oregon look to all of this? No, the scale changed back to where we were originally. Oregon is the yellow at the bottom of the chart. We peaked with a very low number of cases, and it has remained low, which is really good. I'm not always a fan of Oregon government, though I greatly appreciate their success. I've summarized the four charts in a table so we can look at it more quickly and more easily. You can see here, peak cases per day, per million people. Italy and the US peaked about the same point. And as the chart showed, Italy has come down to around 12, where the US is around 73. New York, in comparison, peaked at about 5x the US average and is still well above the US average to 133. Oregon has remained low, thankfully, in comparison, and steady about where Italy is now. As time goes by, the daily cases adds up to considerably large total caseload per million people. But we don't usually speak about cases per million. We usually speak as percent of population. So let's move the digits over, and as a percent of total population, we're looking at around 1% or considerably less. It's also agreed upon that more people have had the virus and have been tested. Studies vary. Let's say 10 times more people have had the virus than have been tested positive. That would put the total number of people in both countries at around 4% of having had the virus, and about 17% of New Yorkers. So overall, a small percentage of the population have had the virus, which is something I'll come back to later. Let's start putting some pieces together because That's what I said I would do in this talk. We just looked at the coronavirus numbers. Let's look at the public health data. This chart shows time by month on the bottom going out to next summer. The left axis is 4 million, which is the number of people who live in Oregon. And the right axis is percent, adding up to 100%. A lot of this information we're quite familiar with. It's just not laid out quite like this usually. We're shut down through early June, large crowd events, at least to the end of September. We're expecting it to take a while to get a vaccination. And then social distancing with testing and contact tracing. Here, you can see the New York caseload increase using the 10x assumption. Around 17% of their people have had the coronavirus. In Oregon, using the same 10x assumption, they're more around 1%. And everyone is trying to keep the virus load very low at around 1% of the people as we get back to work and get back to our normal lives or something similar. We want to miss having a spike later on in the year. And by the way, we'll have a presidential election in November. Let's go on to the next topic. Being the public, and what the views are around the public and people. In a pandemic movie, there are dead people in the streets. New York was bad, but not movie bad. Have you been lucky enough to be working from home and still have a job? You've been kind of bored hanging around the place, likely don't know anybody with it or few people, and are so over this. If you're unemployed, you're likely suddenly without health insurance and glad for the extra $600 in unemployment, which hopefully you're getting. And overall, everybody has a question, am I safe? Around the business world, it's anything but boring. For business owners and companies, it's terrifying. There are many metrics for measuring business. I'll let others handle those numbers. A lot of companies, it's either no business or more than they can handle. There's a lot of supply line issues. The federal government's tossing around a lot of money, trying to back people up. Originally, it seemed like with change comes opportunity. Now it feels much more like just simple survival. And of course, there's no talking about the US these days without mentioning President Trump. He's simply a brilliant mass marketer, though his leadership style is much different than most leaders. Humiliation, conflicting messaging, disregard for information, and he likes to break things. So coronavirus somewhat hits his Achilles heel. Very little of his skill set can help with, and how he generally does things, help with a pandemic. He's aware America needs to get going again, largely before the Payroll Act ends and state unemployment funds, which are many states are low, are gone, and before his November election. So what about the US as a whole? Well, the aforementioned White House with Trump and the federal government and the 50 state governors, the United States of America feels much more like a federation of individual states these days. So in looking at all these 6 pieces of that I just have talked about, sliding them together, there are a lot of loose ends, and there are not many interconnections between them. It's all very frustrating. What do we do? Well, the future is determined by our actions, and stay tuned, folks. Looking at the future a little bit more systematically, modeling is usually based on a repeating process, service product sales, but we have a constant in this problem with the virus. It's consistently very contagious. The variables are how we as individuals interact and medical solutions that many people are working on. And the coronavirus is just getting started. So in conclusion, this is a public health issue and continues to be. Balancing how we can be active and not sharing the virus. With the assumption of the 10x caseload, New York's at 17%. Everybody else is considerably less in the US. Angela Merkel said back in early March, the Chancellor of Germany, by the way, that she expects 50 to 70% of Germans to get the virus. For US to get to that level, we'd have a couple times repeat of New York, and the rest of the country would go through a lot of horrible times as well. Let's hope that does not happen. In conclusion, it's about our collective behavior, along with medical advances. In the meantime, social distancing and wear those damn masks. Thank you for your time. Next in this series, I'll talk about using the public health data to tell if you're relatively safe and where you live in the country. Thank you so much. Take care.